Hey there, let's talk about what a Part C is, also known as a Medicare Advantage plan. All right, my name is Lori, and I love making Medicare and Social Security easier to understand. All right, so let's get into it. What is a Medicare Advantage plan, also known as a Part C? They are the same thing. A lot of people get confused because they hear these words being thrown around and they think they're two different choices, and they're actually not. They're actually one plan, one product, one policy. Okay, all Medicare Advantage plans have to be set up pretty similar until they get to the ancillary products. They all have to have Part A, which is your hospital insurance. They all have to have Part B, which is your medical insurance. And some of them have Part D as in dog written into them also, which is your drug coverage. There's two type of Medicare Advantage plans. One is called a Medicare Advantage, and one is called a Medicare Advantage prescription drug plan. Medicare Advantage, you'll hear the acronym MA, and then with Medicare Advantage prescription drug, you'll hear the acronym MAPD. So, why would somebody want to pick a Medicare Advantage plan? Because they are managed by private insurance companies with like Humana and United Healthcare and companies like that. And they are restrictive. So, why would you pick it? Well, a lot of people will pick them because the premiums are really low. Sometimes, in most of the cases, it's $0. And there are a few Medicare Advantage plans out there that have a premium, but they're not very high. All right. So original Medicare paired with a Medicare supplement, also known as a Medigap, the premiums can be very costly. So a lot of people will go to a Medicare Advantage plan, or also known as a Part C. They also will go this way because an original Medicare does not cover vision, hearing, and dental, and Medicare Advantage plans, 99% of them cover vision, dental, and hearing. So most of the time when you pick a Medicare Advantage plan, you're going to get those extra benefits like vision, dental, and hearing. And that can be really important to somebody. All right. But you have to keep in mind that these plans are managed by private insurance companies. They have networks. They have max out of pockets, which is a MOOP, MOOP. That is the most that you'll pay for your health care for the year. January 1st, it resets. But I want to stress the copays that you pay towards your MOOP, all right, or your max out of pocket are not from your drug copays or your Part D copays. They are only from when you go to the doctors or the hospital. And once you've hit that number, whatever it is, most of the time it's 3,500. I've seen them as low as 1,500. Once you hit that number, then you're not going to pay another copay for the rest of the year. January 1st, it resets and you start all over again. Okay. So, what type of plans are there for you to choose from? The most popular is going to be an HMO, Health Maintenance Organization. Why? Because the copays are really low. Obviously, the premiums are really low, and the max out of pockets are pretty low. And they have a lot of extras like over the counter. They have things like gym benefits. And a lot of those are going to give you some extra benefits that those company, a lot of them are going to give you extra benefits. And that really is enticing to people. Then you have your preferred provider organization or PPO. Here's what I'm going to say about a PPO. While they're great, not every doctor is going to accept it if you go out of network. So you have two choices. You can be in network or out of network with a PPO. The in network is going to have one set of copays, and your out of network is going to have another set of copays, and they're both going to have their own max out of pocket or MOOP, and they can be pretty high. I've seen them as high as $10,000 on the out of network um, side. Here's what I want to say about those. The copays are going to be higher because you have more choices to go and you can go out of network. Is it a good plan? Absolutely, it's a good plan. And if you're like, just say you're in the state of Florida and you travel around, but you don't really leave the state, a PPO might be a good option for you because you have coverage in the entire state of Florida versus where a Medicare supplement you would have coverage all over the country, but you're paying more for the Medicare supplement. All right. So then your next one is going to be your private fee for service or PFFS. These are less common types and it allows you to see any Medicare approved provider who accepts the plan's payment terms. That means that you are paying the provider and it's usually got a fee schedule and they are already set. All right. Then we go into the special needs plans. These are going to go back up to your HMOs and your PPOs. And the most commons are going to be your DSNP, which is dual eligible, which is Medicare and Medicaid together. If you have Medicaid in your state and you are on Medicare, you are dual eligible. Why would you pick a dual eligible? Because it gives you $0 premiums. It gives you $0 copays. It gives you extra benefits. And in some cases, it gives you extra benefits like transportation, food benefits, over the counter. And then on the CSNP, which is a chronic plan, you have to have diabetes, or yeah, diabetes. You have to have lung disease or heart disease, and there'll be a form that will be sent to your doctor to prove that you have these. And in most cases, it will help reduce the cost of your medication and give you extra benefits that you need. For example, if you have a CSNP and you are diabetic and you need to be on a certain, food regimen, sometimes in some areas you'll get a food card that will give you a little bit of money to go out and buy healthy foods like fruits and vegetables and lean meats. All right. So those are the most common types. What are the benefits of combining all of this together? Like I said earlier, vision, dental, and hearing, that is the most popular. Over the counter, set premiums, low copays, and your prescription drug plan is built into it if you're on a Medicare Advantage prescription drug plan. And then, they have incentives like health coaching, diabetes management programs, preventative screening. You can get gym memberships, over the counter, transportation to medical appointments. And like I said, in some cases, a food benefit. All right. What are the drawbacks? Well, we all understand that with managed healthcare, you have to have referrals, right? With a PPO, you don't have to have referrals, but with an HMO, you do have to have referrals. But with both a Medicare Advantage plan, HMO, and a PPO, they can actually deny your claim. So if your doctor says that you need to have this procedure and they have to get a pre-authorization from the insurance carrier, if they feel like it's not necessary, medically necessary, they might deny the claim. So that is a drawback, right? And then another drawback with Medicare Advantage plans is that doctors are not tied into the same rules and regulations that you are with your plan. They actually can leave the plan anytime they want for no reason. They might just not like a certain company like ABC Medicare. They don't like working with them anymore, so they pull out. Then that gives you a choice to make. Do you want to, one, get another doctor, or two, do you want to use a special election because your doctor dropped your plan and pick another plan with another carrier that he accepts or she accepts? So there are some drawbacks to having a HMO or PPO with a Medicare Advantage plan. All right, enrollment. How do you enroll into a Medicare Advantage plan? First, you have to have Part A and Part B. You have to have those to get onto a Medicare Advantage plan. You will pay the Medicare Part B premium, which is $185 for 2025, but you're not going to use that Medicare card. You're going to put it in a drawer, you're going to close the drawer and forget about it. And then you're going to go by your plans, rules, and networks, okay? You have to be 65 or older, or you have to be on Social Security disability for SSDI for 24 consecutive months, and then you will get enrolled into Medicare, original Medicare, and then you can make a decision if you want to go on a Medicare Advantage plan or a Medicare supplement. If you have end-stage renal disease or ALS, then you will automatically be enrolled into Medicare, and then you can make a decision whether you're going to go on a Medicare Advantage plan or a Medicare supplement. You can only switch and drop your Medicare Advantage plan during special times. Annual enrollment period, which is October 15th to December 7th. You can always, it doesn't matter who you are or where you live, you can always change your plan during that time for January 1st. It's not automatic, it goes January 1st. If you have other SEPs or special elections, you can go ahead and use those. Like maybe you want to use a 5-star. There's an SEP for a 5-star plan. And the 5 stars, I'm not going to name plans here because the 5 stars are different in every area. But if you have a 5-star plan in your area and you want to move to it, you can use that SEP one time throughout the year. maybe you moved from a place like New York to California. That would be an SEP for you to go ahead and switch your Medicare plan once you get out to California. Maybe you have gone from independent living in your own home to a nursing home, long-term care home. Now you have an SEP to go ahead and get a new plan on the Medicare Advantage side. Maybe you've just gotten out of prison and all of your benefits have been turned back on for you. That's an SEP to go ahead and get on a Medicare Advantage plan. So you would have to have a Medicare special election or an SEP to get onto a new plan throughout the year. All right, so if you guys have any questions, put them in the comments and I will answer them and make another video for you if I have to. If you want me to go into depth about anything, put that in there. Please like, follow, share, and subscribe, and I will talk to you soon. Have a wonderful day, and I appreciate you coming here.